News 5 o'clock, the TSA will extend its federal mask mandate until January. It was set to expire next month, so masks will still be required on all planes, buses, and trains.
Greenwood schools now say that it will require masks for all students and teachers. That mandate goes into effect tomorrow. And another district is going to an all-remote learning. Mechanical schools say that at least 76 students have tested positive for the coronavirus. The high school is dealing with a 64% absentee rate. This comes as the state reports more than 1,500 hospitalizations for the first time since February. Now, the Indiana Hospital Association is urging Hoosiers to please get vaccinated. It says that hospitalizations increased 288% since the 4th of July. The group says 766 people were admitted during the first week of August. All but 8 of those people were unvaccinated. 137 people were admitted to the ICU. All of them were unvaccinated. And this surge is creating a pretty big strain for frontline workers and serious staffing shortages as well. The IHA warns that if this continues, everyone in need of health care could be impacted.
Well, the U.S. could face a new challenge soon, convincing Americans to get booster shots. Top health officials in the Biden administration could recommend an extra dose as early as tomorrow, when we expect President Biden to talk about the issue at the White House. The booster would come 8 months after getting the second shot of either the Pfizer or Moderna vaccine. The move is driven by both the Delta variant and initial evidence that the vaccine's protection starts to drop within months. Boosters are already recommended for the immunocompromised. If expanded, healthcare workers and older people could be among the first to get them. So what would a booster shot mean for you and the fight to keep the coronavirus variants from spreading? We put that question to Wish TV medical expert and former Surgeon General Dr. Jerome Adams, and Dr. Adams tells us the move is based on what doctors have learned from vaccine studies in Israel.
The vaccine was still effective against preventing severe disease and hospitalization and death, but there was still spread going on. There were breakthrough infections that were causing spread, and they gave over 1 million people there a third dose and saw significantly increased immunity, antibody levels after that third dose was administered. So really what they're doing is following the science here. And the science says you're still protected from hospitalization and death. But if we want to break the chain of spread, then it's important that we start getting people these third booster doses.
Dr. Adams went on to tell us that the U.S. could begin giving booster shots in late September or early October. He also expects those who were first to get the vaccine, including medical professionals and those in nursing homes, would be the first to get the booster shot.
A breach of the state's COVID-19 online contact tracing information affects 750,000 Hoosiers. The data taken included names and addresses, emails, gender, ethnicity, and date of birth. The state says that the company that accessed the data intentionally looks for software vulnerabilities, then reaches out to seek business. The state says that the company signed a certificate that it destroyed the data and did not release it to anyone else. The state also plans to send letters to affected Hoosiers and offer a year of free credit monitoring.